Have you ever wondered how we put a value on health improvements? Especially when we're comparing really different medical treatments. How do decision makers weigh up what actually matters most? Today, we're taking a deep dive into something called quality-adjusted life years, or QALYs. They're a crucial, though sometimes kind of opaque, metric in health economics. Think of it as a key piece of the puzzle in, well, figuring out how healthcare resources get allocated.
Exactly. And we'll be digging into the insights from a really pivotal 2004 research paper. It's by Gerald, Richardson and Andrea Manca. The title is Calculation of Quality-Adjusted Life Years in the Published Literature, a review of methodology and transparency.
Quite a mouthful.
It is, but their mission basically was to look closely at how QALYs were actually being calculated and reported in studies that were done alongside clinical trials.
Right. And our mission today is to sort of reveal why consistency and clarity in these calculations really, really matter, and how vital it is for these numbers to be, well, reliable. You might actually be surprised by what Richardson and Manca uncovered back then.
Okay, let's unpack this then. The core finding of that 2004 paper was pretty stark, really. The methods used to calculate QALYs, often inconsistent, and poorly reported across the published research they looked at. So why should you sit up and pay attention to this? Because, as the authors found, these methodological choices, how they crunch the numbers, it can actually influence not just the size, the magnitude, but even the direction of a study's results.
Yeah, it's quite something. And what's really fascinating here is how they uncovered this. They did a very detailed review. They looked at 23 published cost-utility analyses. These were all studies done alongside randomized controlled trials, real-world data, essentially.
Yeah.
And they meticulously examined each paper, really digging into the specifics of how the QALYs were derived, how they were presented.
So, okay, digging into the details. What specifically did they find? Well, for one thing, different studies were using different tools to measure health status. Different questionnaires or instruments.
Like the EQ5D, I've heard of that one.
Exactly. The EQ5D was the most common one they found. It looks at things like mobility, self-care, pain, usual activities, anxiety, depression, 5 dimensions. But others use things like the Health Utilities Index. And they also varied in how they measured people's preferences for certain health states.
Preferences, how do you measure that?
Using techniques like time trade-off. That's where you ask someone, hypothetically, would you prefer 10 years in your current health state or maybe, say, 8 years in perfect health?
Ah, okay. Trading time for quality.
Precisely. Or the standard gamble, which involves a choice between staying in a certain health state or taking a gamble on a treatment that could either return you to perfect health or, well, lead to a worse outcome, even death.
Wow, okay, so different tools, different ways of asking about preferences.
Yeah. And if we connect this to the bigger picture, using these different measures and techniques, it can lead to significantly different QALY scores, just fundamentally different numbers.
Which means comparing the cost-effectiveness results from two different studies could be really misleading.
Highly misleading. If you don't account for those underlying variations and how they got the QAY number in the first place. The paper really emphasizes treating such comparisons with caution. It's like comparing apples. And, well, slightly different apples maybe, but different enough to matter.
Okay, so that's the consistency part. What about transparency? This is where it gets really interesting, you said.
Yes, the transparency front. The study revealed a pretty widespread lack of clear reporting. It was quite concerning.
How bad was it?
Get this. Less than 2/3 of the papers they reviewed, only 61% actually reported the baseline and follow-up utility scores.
Wait, the actual scores people started and ended with?
The very scores.
Yeah.
Which are absolutely crucial if someone else wants to understand or even try to reproduce the results. You need those starting and ending points.
That seems fundamental.
Only 61%.
Only 61%. And it gets worse. Less than half, just 35%, even presented a measure of variability around those utility estimates, like a standard deviation or confidence interval.
So no sense of how much those scores might naturally fluctuate.
Exactly. Which raises a big question. If you can't see the underlying data or get a sense of the uncertainty around the numbers, how much can you fully trust or replicate that analysis? It becomes incredibly difficult.
Yeah, I see that. What else was unclear?
Well, the authors also found that assumptions about how utility changes over time were often unclear. Did they assume it just changed in a straight line between measurement?
A linear progression.
Right, or something else. Often it wasn't stated. And even the basic calculation method, often called the area under the curve approach, which is basically summing up the quality of life over the time period.
Like calculating the total quality time.
Sort of, yes.
Yeah.
Even how they did that varied between studies, or sometimes it just wasn't explicitly stated what method they used. So lots of missing pieces in the reporting. And maybe the biggest piece they found missing was the missing data itself.
Ah, yes. Missing data. This was a huge one. Can you believe that most studies simply ignored the issue of missing data entirely?
Ignored it. Just pretended it wasn't there.
Pretty much, or didn't report how they handled it. Only a small fraction, just 22%, actually reported using any form of imputation.
Imputation. That's like filling in the gaps based on the data you do have.
Exactly. Estimating the missing values. Only 22% reported doing that, and an even tinier number, just 9%, bothered to do sensitivity analyses.
To check how much difference their gap-filling method made to the final result.
Precisely. To test if the way they handled missing data might have skewed the conclusions. Only 9%.
Wow. That feels a bit like building a house, but ignoring a few missing bricks here and there.
It's critical because, as the authors really forcefully pointed out, ignoring missing data or handling it poorly can lead to substantial biases. You can end up with completely erroneous conclusions about whether a treatment is cost-effective or not.
So what was their bottom line? Their recommendations.
They strongly recommended that analysts must be transparent about their chosen methodology. Spell it out clearly. They also suggested accounting for baseline differences between patient groups using more robust statistical approaches like multiple regression. And crucially, always deal with missing data appropriately and report how you did it.
So what does this all mean for you listening in? This deep dive into QALY calculation, it isn't just some academic quibble about methods.
Not at all.
It's really about ensuring that the decisions being made in healthcare economics, decisions that affect real people and resource allocation, are based on data that is clear, consistent, and importantly, reproducible.
Which really raises a big question, doesn't it? Given these pretty compelling findings were from 2004, and here we are now in 2025.
Yeah.
How much progress do you think health economics research has actually made? Have we really embraced that transparency and consistency in QALY estimation? Makes you wonder, doesn't it? Is that devil in the details still lurking there, maybe hiding in plain sight in some studies?
That's a really provocative thought. Definitely something to keep in mind the next time you encounter a study claiming one health intervention is more cost-effective than another. Understanding how they crunch those numbers, how they got that QAY value, well, it really does make all the difference.